Hi, my name is Madison Carithers. I went to Clemson University for undergraduate. There, I got my degree in health sciences with minors in both business administration and biology. I am currently a bioethics and medical humanities master's student at Case Western Reserve University. Over spring break, I had the opportunity to travel to the Netherlands to learn about the bioethics and healthcare policies regarding drug use. Currently, in the United States, children in school learn about drugs through many different programs. These programs mainly use abstinence when teaching about the drug use. The goal of this video is to show how our biases and perceptions of drugs, specifically heroin, causes us to have a negative stigma towards non-abstinence drug treatments and negative stigmas towards people that suffer from drug addiction. This video will show how education on heroin and different treatment programs that do not use abstinence can change people's perceptions and the stigma surrounding people who do use heroin. I selected the people in the video from the bioethics program here at Case Western to ask them questions about their opinion and knowledge about heroin, drug user rooms, and different treatment options.
Hello, I'm Matthew Jordan. I study biochemistry at Stetson University in Florida.
Hello, I'm Shafe. I studied biochemistry and cell biology at Rice University.
It's your boy Shrajal Desai, aka SJ. Went to the University of Illinois at Urbana-Champaign. I was a double major in honors biology and economics. I minored in chemistry.
Hi, my name is Nicholas Gutierrez. I'm a Johns Hopkins University student graduate. Major in neuroscience, minor in psychology.
My name's Jacob. I graduated from Colorado School of Mines and my major is in chemical and biochemical engineering.
Hi, my name's Amanda Pupo. I went to Case Western Reserve University for my undergraduate career and I majored in psychology. I went on a trip to Amsterdam for spring break.
Before going to Amsterdam, I didn't really know exactly what heroin was or how to inject it or what happened when you took it. I just assumed that you got high from taking it and that it must feel good.
It's an illegal drug. I mean, there's very few reasons nowadays for it to be used. But obviously they had uses. I think back in the cholera epidemic in the 19th century in London, there were doctors who swore by it. But nowadays there's so many better things to be used.
Don't know much about heroin. I know it's an opioid derived from a poppy plant. It's highly addictive. It's illegal. It produces feelings of euphoria. I think it comes from like Afghanistan and somewhere in like Asia. I think it can be used in medical settings. Don't know. It might vary between countries.
Heroin's an opioid. It's most often used recreationally to obtain like a euphoric high. It's abused a lot in the United States, you know, because of the opioid crisis. I know you can inject it and you can snort it.
I know the opium epidemic is correlated with pain drugs that were given, and then users, as they couldn't get more pain drugs, eventually just went for like harder forms of opiates such as heroin.
I know that heroin is a drug often abused. It's an opiate. I know that you can inject it, but other than that, I don't know too much about heroin.
I agree with providing free, clean needles to anyone regardless of their health insurance status. I believe that this is a way to reduce health costs for people that do come in with infections because of their intravenous drug use. I also think that it's a great harm reduction strategy to prevent the infection from happening in the first place.
Giving clean needles is for heroin, for various different drugs. It's very useful for public health.
I think it's a good idea. I think it'd be better for it to be in a controlled, educated way as opposed to you finding some dirty needles and spreading disease.
I can see the benefit of it because it allows an individual to use heroin in a safe environment. I don't understand why institutions or governments using this method aren't trying to kind of tease the individual off the heroin addiction. They're just kind of allowing it to occur, so I think that's kind of a major issue. They're just kind of allowing it to happen in like a safer method.
I am very pro giving them clean needles just because we've seen, at least like in the States where programs like that come out, you get a lot lower like infection rates for like a lot of different stuff. So I feel like that's a good program to have.
I can understand the benefit of giving heroin users clean needles. The idea of if it's going to happen, might as well make sure it's safe. But at the same time, I have an issue with it because that could be promoting the use of heroin.
Prior to going to Amsterdam, I thought the needle exchange programs are important, and I think it promotes good hygiene, especially for those who are addicted.
When I thought of drug user rooms, I thought of people kind of just like going into a room that probably had chairs and they injected heroin and then they left. I didn't really think about that it could be a safe place for them to use. I just thought of it as a cleaner environment, but I never really thought about that they could be getting free needles there.
Overall, it's probably pretty good just because of the risk reduction, harm reduction, and by giving them a clean, safe place to do it with medical personnel on hand.
The image I have in my head is an abandoned building, dark, no furniture, people just kind of sitting around doing drugs, sharing drugs and needles.
I would presume the room itself would be very large. It would be very comforting and safe for the individual to come in and actually use drugs. I think that the option of having the room gives an individual more leeway to maybe think about using safer alternatives and methods to drug use. But overall, I find that the institutions and governments that are using drug rooms need to address the bigger problem that is drug addiction use altogether, not just safer or more safe drug use.
A room where we let people inject themselves and do drugs recreationally? I don't know how I feel about that, but just letting addicted people take drugs within the context of trying to treat them, I just don't know how efficacious a program like that could be.
I hadn't really heard of them, but based on the name, I would guess it's a place that a person could go and safely use a drug of choice. I think it provides a safe environment for people to use these drugs, but at the same time, I think it can make it more accessible for people and potentially promote the use.
Before going, I kind of had a very American-centric view on hard drugs such as heroin. I was a little worried prior to going that it was going to look like that it was just going to be a bunch of druggies everywhere.
Before going to Amsterdam, I was very against physicians prescribing people heroin. I believed that it would be maleficent. It's prescribing them a drug that you know could harm them and be very addictive and only progress their addiction further. So I thought it was very wrong for physicians to give patients pharmaceutical grade heroin.
There's obviously benefits to this practice. The biggest issue is, would it be encouraging? Overall, it's probably more in the good than the bad.
I'm going to assume it's probably really hard to stop cold turkey. I think that easing them out of it, I'm assuming that's why they're probably getting prescribed heroin, is definitely probably more practical than just stopping immediately.
I think that has to be very limited and only used in extreme cases. So I'd just be wary with letting physicians just have free range of giving very intense doses of heroin to people.
I think physicians should be allowed to prescribe it, but I think that should be very well regulated, better than the current opiate prescriptions now.
So I know people that are addicted to heroin or opioids in the United States can get methadone from different treatment clinics. I know that it is often very hard for people to get access to methadone, either because of their health insurance status or because the treatment facilities are so far away from them.
I don't know much about drug abuse treatment in the U.S. I just assume people, if they go to rehab.
No idea. I'm going to assume it's a lot of variation in it.
No, but I bet you it's poor.
Not really, but I'm guessing there's like problems with access.
I am not too sure of any of the drug abuse treatment programs in the United States.
I did know that we use medicated assisted treatment for addicts who are addicted to drugs. I wasn't really sure of their efficacy.
According to the National Institute of Drug Abuse, heroin is an opioid drug made from morphine, which is taken from the seed pod of various opium poppy plants. Heroin is often cut with additives such as sugar, starch, and powdered milk before it is sold illegally. Heroin was first sold by Bayer in 1898 as a treatment for tuberculosis, as a child's cough medicine, and as a remedy for morphine addiction. Heroin can be intravenously injected into the bloodstream with effects in under 1 minute. It can also be injected into the muscle, which causes effects in 5 to 8 minutes. Or it can be snorted and smoked, which causes effects in 10 to 30 minutes. The first effects of heroin are a surge of sensation, followed by a warm feeling on the skin and a dry mouth. Heroin lasts 4 to 6 hours after consumption. Without doing it multiple times a day, people will go into withdrawal symptoms. In 2011, 4.2 million Americans aged 12 or older reported that they had used heroin at least once in their lives. One alternative to heroin is methadone. According to the Substance Abuse and Mental Health Service Administration, methadone is a safe and effective drug used in medication-assisted treatment for people that are addicted to heroin or opiates. Methadone lessens the withdrawal symptoms and blocks the euphoric effects of opiate drugs. Methadone is taken once daily. It can also be addictive, so it is only dispensed from a physician at an opioid treatment program. According to the National Institute of Health, addiction is recognized as a chronic, relapsing brain disease with a wide range of serious medical consequences. The American Psychiatric Association stated that people suffering from substance use disorder often have distorted thinking and have behavior and body functions that create an intense craving for a drug. In 2014, the National Survey on Drug Use and Health found that 21.5 million Americans aged 12 or older had a substance use disorder in the previous year, with only 2.5 million of those receiving specialized treatment. Between 2002 and 2004 and 2011 and 2013, the past year use of heroin had increased by 62.5% and abuse and dependence by 90%. According to the Centers for Disease Control and Prevention, in 2017, 15,482 people died from heroin-related overdose deaths. This rate had increased almost 400% between 2010 and 2017. Ethan Nadelman and Lindsay Lassell, in their article 2 Steps Forward, 1 Step Back, state that less than 10% of individuals with opioid dependence received methadone, and only 9% of drug treatment facilities in the U.S. offer specialized treatment of opioid dependence with opioid agonist therapy. The National Institute of Health stated that only about 20% of the estimated 810,000 heroin addicts in the U.S. seek or receive any form of treatment for their addiction. According to Merriam-Webster Dictionary, stigma is a mark of shame or discredit. People in the United States often have a negative stigma of drug users. Joseph Palomer came to the conclusion that those who stigmatize drug users are less likely to use themselves, but stigmatization does not decrease use. Between October 30th and December 2nd of 2013, Colleen Berry, an associate professor in the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, and her colleagues surveyed a national representative sample of the attitudes towards people that suffer from drug addiction. Only 22% of the respondents said that they would be willing to work closely on a job with a person that has a drug addiction, compared to the 62% that said that they would be willing to work with someone with a mental illness. 64% said that employers should be able to deny employment to people with a drug addiction. 43% were opposed to giving individuals that had a drug addiction equivalent health insurance benefits to the public at large. According to Nadelman and LaSalle, the U.S. treatment programs in drug education is still predominantly abstinence only. In Chasing the Scream, it discusses the subconscious effects this education has on us. The book states that it is etched into our subconscious to treat drug users and addicts as criminals, repress them, shame them, and coerce them into stopping. Currently, the United States imprisons more people for drug offenses than Western European nations imprison for all the crimes combined. This shows the U.S. approach to drug addiction is a criminal situation and not a public health situation. In 2015, Congress lifted the ban on federal funding for programs that provide sterile syringes. In the U.S., there are currently 14 states that have no syringe exchange programs for intravenous drug users. In 12 states, there are only 1 or 2 cities that offer this program. This results in only 3% of the need being met. Drug interventions are not usually supported by the public and believed by some to facilitate and encourage drug use. In Chasing the Scream, it speaks of the rat park experiment. The rat park experiment showed how a person's environment changes with their behavior. It was noticed that rats in experiments were often in cages all alone with no toys or activities. So they decided to change that. The rat park experiment consisted of 2 boxes. The first box placed a rat into solitary confinement, while the second box had wheels, colorful balls, food, and other rats that they could socialize with. Both of the boxes had 2 bottles. One bottle was filled with water and the other was filled with morphine. It was found that the rats in box 2, which was the happy cage, used less than 5 milligrams of morphine, while the rats in box 1, which were in confinement, used 25 milligrams of morphine. This experiment showed just how important environment is when dealing with drug addiction. The Opium Act directive states that the Dutch drugs policy aims to discourage and reduce drug use, certainly insofar as it causes damage to health and to society, and to prevent and reduce the damage associated with drug use, drug production, and the drugs trade. Currently, the Netherlands uses a pragmatic approach to drug addiction by implementing harm reduction strategies. Harm reduction for hard drugs was first introduced in 1995. Hayhow and Lowe stated in their article, Addicted to the Good Life, that harm reduction begins with the premise that the unhealthy behavior is inevitable in a community. Harm reduction allows the Netherlands to focus on the harmful outcomes of a behavior rather than the behavior itself. According to the European Monitoring Center for Drugs and Drug Addiction, harm reduction in the Netherlands is done through outreach work, low-threshold facilities, and centers for social addiction care that deal with difficult-to-reach drug users. The goal is to reduce drug-induced deaths, drug-related infectious diseases, and prevent drug-related emergencies. The European Monitoring Center for Drugs and Drug Addiction also stated that needle and syringe programs were first established over 30 years ago in the Netherlands. It also states that the first drug consumption room was established in 1994. Supervised consumption sites go by many names: drug consumption rooms, injection rooms, and safe injection facilities. These are all legally sanctioned programs that allow people to consume illicit drugs under the supervision of trained staff. While in Amsterdam, we visited the AMOC drug consumption room. There, Cedric told us about drug consumption rooms in the international network of drug consumption rooms. At this particular drug consumption room, they provide showers, clean clothes, toothpaste, and toilet paper for free, and they also sell toothbrushes. The drug consumption rooms are built on repression, prevention of harm, recovery, and harm reduction. This is a tertiary model of harm reduction. Their goal is to promote safety and hygiene in a stress-free environment while preventing overdose, HIV and Hep C infection, reduce crime, and reduce loneliness in long-time drug users. In the Netherlands, there are also facilities that you can live in. Living facilities are for people who have tried to quit drugs in the past and have been unable to. Woodstock is one of those living facilities for people over the age of 45. Woodstock does not provide heroin, they only provide methadone, so the people are required to go out into the community and purchase the drugs illegally. Another place for drug treatment is the GGD. The GGD has outpatient clinics within integrated facilities. This provides addiction treatment including methadone and medically prescribed heroin. According to Tejas Fazer at the GGD, people have 30 minutes to take their prescribed heroin. The GGD clinics do not give people the opportunity for socialization within these 30 minutes. Within the clinic, life expectancy is higher than the average person with an addiction to drugs. Although only 5% of the people that go to GGD clinics wean themselves off and stop taking methadone or heroin. The GGD believes that a person needs intrinsic motivation to quit, so they do not pressure them to quit because they believe relapse will be very high. My opinion on giving people clean needles to use has stayed the same. I still think that it's very important for harm reduction. I think that it's very important to keep infection rates down as well as reduce the harm to the person that is using the drugs.
Not really. I think we could be doing a better job with it.
My opinion about giving them free needles has been relatively the same still. I still think it's beneficial to allow them an opportunity to use heroin in a safe manner. What I still want to emphasize is the need to allow an opportunity for these individuals to kind of wean off the heroin and help their addiction.
It did not change. Seeing the statistics about like how many states have programs, I'd really like to see more states approach these programs with an open mind.
To kind of see it up close and I guess discuss with us in depth at the drug user rooms only kind of confirmed how I felt about it. They're not necessarily just like giving people needles and letting them do what they want. They promote good hygiene when using it. I think that's also something really important, something I'm not even sure if needle exchange programs do here, but I think that's super important,
My opinion did change on what a drug user room was. I didn't realize the amount of community that could be formed through a drug user room. What I did learn in Amsterdam was that loneliness is often one of the factors of drug addiction, and many of the drug user rooms do try to combat this problem by creating a social environment that people can get to know one another and have that help them out of the drug addiction rather than other people pressuring them to get out of the drug addiction.
I expected something a lot more informal and a lot worse for the user. I understand it to be somewhere that's a safer alternative.
Yeah, so I know now that the drug user rooms don't supply the heroin, which actually, in my opinion, puts them in a little bit of a more positive light. It allows them to use the heroin with other people. I know that there are other people there, and so that social influence may help a role in individuals not only using the drug safer, but possibly even them working together and trying to wean off heroin as a group, which may be more beneficial than someone going about it alone. So that way I really see them more in a positive light.
Yeah, it did change quite a bit because I feel like I came in with this mentality that I feel like is very American, where we kind of just see any sort of help towards drug taking as something that's just vile and bad when it can be like objectively good. Like in many cases where it actually caused certain types of crime to go down and stuff like that. So I feel like I would be more content with these type of programs so long as they don't directly supply heroin.
I do think that drug user rooms are more ethically appropriate and are more right than prescribing heroin, even though they are containing it illegally. I think that the drug user room just promotes more autonomy to the person with a drug addiction. So I do think that it is okay for physicians to prescribe people heroin as long as it's done safely in a controlled environment.
Is it fair that these people are getting free drugs? Where's the justice in that? If they're going out to somewhere illegal to get these drugs, they're breaking the law, they're in probably more dangerous areas of the city, then it might be utilitarian and having more utility in order to give it to them for free to prevent the harm that would befall innocent bystanders.
So I think it's less problematic for the facility to be using their own drugs so that they can kind of control the whole process. But then that just kind of seems like they're completely just like giving drugs. I think there's a lot more error that can happen with allowing the user to get their drugs from an outside source unless they're testing it. I would say that'd be a lot more ethically problematic to allow the user to bring their own drugs.
From an ethics perspective, I think that if they're going to supply the heroin, they need to have some objective and agenda to wean them off the heroin. If they're going to allow the individuals to bring the heroin from outside, then there's a bit more justification as to their role in just having a facility for safe use.
I disagree with giving pure heroin. I think methadone is a pretty good way to treat heroin addiction. I think just giving pure heroin without actually trying to solve the underlying disease is a very cure the symptoms, not the cause type of approach. And I feel like that hasn't been the more successful public health programs.
I'm still on the fence about drug user rooms. I'm not entirely sure if it's something that could be implemented here. It seems to be working for the Dutch very well. So ethically, I don't see a difference between a physician prescribing it and then obtaining it illegally. I think from a legal standpoint, that's the only difference. If policy change was enacted where these drug user rooms were able to provide it to addicts legally, it would make it a lot easier for them to obtain it. I think both methods have the same end goal. You're trying to reduce harm to the addict and you're trying to promote overall good than bad.
I think that drug abuse treatment in the United States should be changed. I believe that we should go towards more harm reduction strategies like the Netherlands are doing. I think one of the main problems that the United States has with treating people with a drug addiction is that we try and treat the person, whereas I think that we should be treating the environment. The Rat Park experiment showed us just how important environment was. I think that our stigma and our perception of drug addicts is so deeply rooted in our society that we are going to have to change that first before we can implement any new treatment programs to help these people.
It should be changed. There's a lot that has to be changed if it wants to be successful. There's a long way to go to value public health over giving moral blame and then therefore ignoring these drug addicts.
I think so. I think there's a lot of stigma that they allow to control the policy. I do also like that America pushes towards stopping drug use as opposed to just promoting healthy drug use. I think the ultimate goal for the user should be a lack of dependence on heroin.
Absolutely. Drug abuse in this country is not even talked about nowadays. It hasn't really been addressed. There are no effective methods to help individuals who are addicted to drugs. Whether or not drug abuse rooms would function well in this country is a completely different conversation, because it's really important to understand that the number of people in this country compared to the other countries is different, and so therefore the effects of these drug use rooms are going to be different. More importantly, the stigma of individuals who are addicted to drugs in this country is far different than other countries. I just learned that the Netherlands is seen as more of a public health issue, and that is absolutely not the case in this country, and so that's something that really needs to be addressed. I understand that pushing individuals who are addicted is the wrong way to go about it, but I still think that there needs to be some emphasis on external factors and the professionals at that facility to help addicted individuals get off the drug.
Yes, I feel like it should definitely be changed and completely overhauled. I think we do a terrible, terrible job dealing with mental health problems, especially addiction, based on like the numbers that we kind of found out. There's like severe problems in terms of access.
After coming back from Amsterdam, I learned that the medicated assisted treatment that we use in the US is only 10% effective. And a lot of it has to do with the time spent in the treatment program and the fact that these people come in with past trauma that's not necessarily addressed.
Public opinion is super important because they're voters. So if we want public policy to change, we have to change public opinion.
I think the image I have is a sad, dark corner with like a really skinny dude with some needles. I think people are less willing to help that person as opposed to someone we can see being a functional member of society who just also has a problem. I think this perception of them is complete, like it doesn't matter if they exist or not.
Perception on drug addiction is important because the perception is going to determine how we not only look at individuals who are addicted to drugs, but more importantly, how we treat individuals that are addicted to drugs. And clearly, the perceptions of drug addicts within the United States can speak to the effective treatments that we have in the US, which is very poor compared to other countries who are doing a much better job.
I think it goes a long way to helping people reach treatment. It definitely impacts people just in the beginning on becoming addicted and reaching out for support, which is always like a big part of the problem. I think just changing that stigmatization and that mentality that we have towards these people would go a long way to enact different policies and also help them throughout the process.
I think perception is everything, even down to the language that we use. When we talk about addicts in the US, it's always in a negative way. We kind of other that population either because we don't want to deal with them, or when we do try and focus on the problem, it's from a criminal standpoint and we enact punishment rather than treatment, and coming at it with more of a public health approach, which is what the Dutch do. In the Netherlands, they educate the population. While we do educate, I think in America, it's always sort of with this like damning language. Basically, this criminalization of drug use started through the Prohibition era. It's also tied back to race and othering other communities as well.
Understanding stigma is important because negative stigma contributes to high rates of death, incarceration, and mental health problems among dependent populations. Oftentimes, people's negative stigma results in them believing that drug addiction should be cured because it is the fault of the person. When realizing your stigmatization of people with a drug addiction, you can start to treat it for what it really is, an addiction that is a mental disorder and a chronic brain disease. This leads to us starting to treat drug addiction as a chronic disorder that might be best treated with harm reduction, not abstinence treatment. Public health policies surrounding drug addiction should be based on pragmatism and not morality or our stigma surrounding it. My opinion did change overall. I'm very glad I went on the trip. It kind of opened my eyes to my own biases that I had put on people with a drug addiction. Going to the Netherlands really just showed me that we need to treat the person as they are anyone else in society. Oftentimes, treatment programs in the United States view the person as an addict and only an addict. I think that there's a lot more to a person besides them being an addict. I think that socially, economically, environmentally, there are a lot of other factors that go into it, and I think that the United States needs to do a better job treating those problems.
A little bit. Kind of just understanding like how different countries treat. I think I just gained a more relative understanding of drug treatment programs and kind of like pros and cons of each, which I didn't really have an understanding of before.
Yeah, quite of them changed, especially this idea that there's different ways of approaching this problem, especially the public health versus ours, which is more like a punishment, prison type of mentality. I think that's something that should have been done a long time ago.
I think after going to Amsterdam, it's definitely changed how I feel, how we present drugs and drug use and addicts. I think if we have this sort of like neutral standpoint on it, we wouldn't treat it as a criminal problem. We would treat it as a public health issue and start helping people as such.
In conclusion, more education on addiction and treatment options that treat heroin and drug addiction as a chronic brain disease will help erase stigma, improve the rate of treatment seeking, and expand drug addiction services. As you can see in the video, many people's opinions did change on the types of treatment that they think should be allowed for treating people with heroin addictions. Hopefully after watching this video, you have gained more education on what heroin is, the different drug treatment programs here in the United States and in Amsterdam, and have formed your own opinion about what you think the United States needs to do while battering drug addiction.